Hello, I'm Dr. Samimi. I'm a board-certified plastic surgeon, and one of the many procedures that I perform is breast augmentation and exchange of breast implant. How are you?
A little nervous.
Little nervous?
Yeah.
So you're interested in having your present implants exchanged with new ones?
After surgery, am I going to go home bandaged up, or can I bring in a sports top to wear?
That's an excellent question. We actually put on a sports bra in the operating room. Sometimes I may even wrap you with an ACE wrap.
What about drains? Do they put drains in?
Typically for implant exchange or even a breast augmentation, we do not place drains.
Okay, so basically the day after, all I'm going to feel is maybe the side effects of the anesthesia and maybe some pain.
Yes, the side effects of the anesthesia vary from person to person, and generally it's not a... Most women do very well actually afterwards.
What they've done is they've put me into a warming system here. Had to change out of my clothes. I even have these fun socks. Look at this. I'm still nervous.
Basically what we'll do is kind of like we had done before. We go back, we'll start your intravenous or IV. Use a little bit of local anesthetic first, then we start your IV. Things you might notice, a small chance of a headache. That can be from not eating, having a cup of coffee or tea if you drink either in the morning, partially from the anesthetics. We have medication, coffee, tea, juice, and cover them if you want it or need it. Your room.
Okay.
Myrna in bed.
I'm really nervous.
Suddenly the reality is wet
Little sting.
I can taste it in my throat.
That's that first little Mai Tai. A margarita.
Yeah. Do you remember any of it?
What?
Do you have any favorite?
I think I've had a very good recovery.
Good. No, you've done remarkably well. You've had some discomfort, which is normal. You need a little bit of time after anesthesia just to get back, because that always tends to affect people. And it's not unusual for you to have to use a little bit of still pain medications at this point. You're just barely 2 weeks out, if I'm not mistaken. Is it 2 or 3 weeks?
We're just over 3 weeks out.
3 weeks. So so sometimes still you may have a little bit of discomfort, and if you do need to take some pain medications, you can basically do most of your activities, but I would want you to sort of still take it a little bit easier, and if it hurts, to stop. You need to wear good support if you're running or exercising.
That's what I'm doing.
Generally, we say wear a bra for about 6 weeks, a sports bra for 6 weeks, but for like special occasions like right now, that's perfectly fine not to wear.
It is okay?
Yes, absolutely.
All right. The only place I did bruise was right in here, and the most discomfort I did feel throughout the past few weeks, more into this side than anything else, but nothing that, caused me to really worry. And I have to say that I was really impressed in your bedside manner during surgery. Knowing that you were there really gave me a lot of comfort.
That's good.
And I would totally recommend you to anyone.
That's very sweet of you. Thank you.
Yes, if anybody is considering having any sort of breast augmentation, any sort of surgery, I totally recommend Dr. Samimi.